Occupational safety. Occupational safety is an important aspect of safety for all students and staff. In cases of emergency, it is important to familiarize yourself with emergency procedures. These include knowing emergency numbers, knowing the location of emergency push buttons, and knowing the relevant escape routes. What are these emergency procedures? For example, on discovering a fire, do not use the lift, evacuate the area and move to the nearest assemble point, assist people with disabilities, etc. If there are fire extinguishers, use them as indicated. In case of an earthquake, you should know what to do. Drop, cover, and hold on are ways of reducing risk and injury. Another important aspect is being able to offer first aid to people experiencing trauma. For stroke, should you suspect the person suffered a stroke, let them lay in a comfortable position, preferable the recovery position. Call the emergency services immediately. Reassure and calm the person down. A chemical burn occurs when living tissue is exposed to a corrosive substance, such as a strong acid or base. Chemical burns follow a standard burn classification and may cause extensive tissue damage. Prompt wound irrigation is the most critical aspect in limiting the extent to dermal burns from exposure to caustic substances. Make sure that any contaminated clothing or jewelry is no longer in contact with your skin. Rinse the burn if you think some of the chemical is still on your skin. Loosely apply a bandage or a gauze. Choking is the mechanical obstruction of flow of air from the environment into the lungs. Choking prevents breathing and can be partial or complete. The person cannot speak or cry out, or has great difficulty and limited ability to do so. Basic treatment includes encouraging the victim to cough, followed by a hard back slaps, and if none of these things work, abdominal thrust, the Heimlich maneuver, or chest thrusts. A sprain, also known as a torn ligament, is damage to one or more ligaments in a joint, often caused by trauma or the joint being taken beyond its functional range of motion. Sprains can occur in any joint but are most common in the ankle and wrist. Treatment for sprains using the acronym RICE: rest, ice, compression, elevation. For further assistance, do not hesitate to call the University of Johannesburg emergency numbers. This includes other emergency numbers. Thank you.